Health literacy, 2 words, seems very simple, but really in essence it's a very complex subject. It is impacted by things such as social determinants of health, housing, transportation. Do you have food? Do you have a proper support system? And to master anything, it takes time.
Health literacy has a huge impact on how patients understand information, how patients react to information, and how we interact with them.
If this group of people represents our community, 9 out of 10 of these individuals would be below a proficient level of health literacy and lack the skills necessary to manage their health and prevent disease. Almost 4 out of 10 of these individuals have either a basic or below basic level of health literacy. To put this into context, an example would be that they're not able to read or comprehend the instructions on a prescription label. The health consequences of a low level of health literacy are profound.
We want the community to be good stewards of their own health, and so how do we help them do that?
Healthcare has been disrupted. These have been a hard couple of years. We're trying to rebuild systems, we're trying to improve healthcare, and as we all move forward, we want to build systems that increase trust and efficiently create trusting relationships so people can be confident in the care they're getting.
To be able to meet people where they're at and to understand how they learn and not utilize a one-size-fits-all model for education would really empower people to feel engaged in their health, but also an active member of their healthcare team and confident in the ability to take action. So here we provide 2 definitions of health literacy, and this is from the Healthy People 2030 Roadmap. So one is focused on the individual and the other is focused more on organizations. But ultimately, these 2 pieces need to work together.
Health literacy starts with trust, that you can have a really good message and a really accurate message, but if it's not received in a way that someone trusts it, action won't be taken. And so I think health literacy is really trust, and then I also think that it's information that someone can understand and that they feel motivated to take action with.
Trust also is something that has to be built over time through frequency. And when we don't have that opportunity to have that experience through our annual physical or through that, once a year or twice a year where we maybe engage with them, the recommendations that we receive may not always be received in the way that we want them to, or delivered in the way that from a healthcare perspective we would want it to be received.
And the lack of trust leads to, I think, delays in care and uncertainty and increased anxiety. For example, if someone doesn't really understand why they should have a colonoscopy and they wait to have that colonoscopy, you could have a tubular adenoma or a colon polyp that we can take out before it becomes a colon cancer. If we wait, that polyp grows into a colon cancer and is much harder to treat and has more significant health problems down the line.
So when we think about the solution that we're looking for, we really want you to dream and think big.
We're primarily looking for a solution that focuses on adults, but also recognize that education to adults can also affect their families' health literacy as well as their children's. We're also looking for a solution that's culturally competent and is accessible, that doesn't need a high level of tech savvy or even tech equipment to use. We're looking for a solution that leverages technology to drive engagement and that can also be scaled beyond a specific community to the larger population.
We're in a human service-based business. This is healthcare. And so while we are obviously fans of technology, we also want to be able to make sure that it is enabled with a human factor that plays out in it.
What we are not looking for in a solution, we are not looking for a solution that creates new educational content, as we believe that that's a space that is competitive and there's a lot of content that already exists. What we are looking for is a creative way for our patients to engage with educational content, or also a way for our providers to understand what our patients are looking for and how to deliver that.
As much as we all love social media, it is a very competitive space. And so to build a brand new social media platform around healthcare may not be the most appetizing tool for delivering within some of our settings. One of the things we also want to pay attention to is the fact that we do not want to add a burden in their experience or their user experience. We actually want to try to offer an opportunity that makes it easier for them if possible.
If we were to find a solution to this problem, I think we'd have better health outcomes in our community. I think we'd have a lower total cost of care, and I think we'd have an empowered population that really knows how to manage their own health conditions.
For the patient, improved health literacy could mean that they feel understood and that they feel empowered in their ability to be an active member of their health and wellness journey.
When thinking about a solution that can be delivered, I think there's a few ways to think about it. There's opportunities for building a solution that is very patient-centered, that empowers people to have an increased health literacy rate within themselves. There's also the opportunity to be able to deliver a solution that supports organizations in improving health literacy as it relates to how they engage with their patients and deliver information. And then there is what we would call kind of gap fillers, or tools that bridge the gap, that work actually between an organization and patients, that help improve that health literacy and even trust.
When we've accomplished our goal, I feel that we're not going to see people when they're in their worst state. They're going to be accessing healthcare along the continuum. So we're going to be able to get in there and do things around prevention and screening and catching things before they become in the absolute worst state. Success is that folks are able to access us when they need us and not when they have no other choice.